We're good? Okay. I'm Dr. Adam Bezon here with Vardy Chiropractic, and for this month we're talking about heart health. Very, very fitting with Valentine's Day and everything going on. It's National Heart Health Month. A lot of things people are starting to recognize and be familiar with is how chiropractic adjustments can lower blood pressure. There's been a number of studies in the past recent years about this. The reason why this kind of comes involved is it deals with stress. People are stressed out. Well, what is stress? Stress is a stimulus which causes your body to be affected, either in a positive or a negative way. Okay? People get irritable, they get angry, but on a physiological level, like on a cellular level, things that can happen are going to be inflammatory processes, that's very important, hormonal release, and this is where heart health kind of comes into play, blood vessel tone. Okay? If you have increased heart rate and increased blood vessel tone, it will change your blood pressure overall. So they did a study. This was back in 1988, so it's a little bit dated now. But what they did was they took a chiropractor and he adjusted a certain number of patients in their thoracic spine. That's going to be the middle of your back. It's going to be right around this area here. Okay? They adjusted this area in particular. And what they found was that when you compared this to a placebo group, there was a significant decrease in both systolic and diastolic blood pressure. What those numbers are, people aren't quite sure what systolic and diastolic mean. If you look at a number, and perfect is that 120/80 that they say, that's that textbook definition. It affected both of those numbers. Very, very good. If we fast forward a couple years to about 2007, they did a group where they adjusted the cervical spine. Cervical spine's your neck. It's going to be this particular area. Way up top at the atlas, we call that C1. If you do that, they found out in the study that it also lowered blood pressure very significantly. According to the study, it ended up doing a drop of 14 millimeters of mercury for systolic and 8 for diastolic. So, what does this do overall? Bottom line, if you get adjusted, it releases nerve stress, which helps your body respond to stress much, much easier, much, much more effectively, which therefore lowers blood vessel tone and ultimately lowers blood pressure. Great way to do it. They found out that the 14 millimeter drop and the 8 millimeter drop is the same as taking 2 prescription medications for blood pressure. So rather than take your medication, spend money on that, get adjusted, and you will have a healthier nervous system and you'll have healthier blood pressure. So that's our tip for today, and have a fantastic February.